Transgender discrimination in healthcare is among one of the biggest problems with the transgender people. Access to healthcare is supposed to be a human right that is regularly denied to any transgender or gender nonconforming person. Transgender and gender nonconforming people frequently experience discrimination when accessing healthcare, from disrespect and harassment to violence and outright denial of service. Participants in our studies reported barrier to care, rather seeking preventative medicine, routine and emergency care, or transgender-related services. These realities, combined with widespread provider ignorance about the health needs of transgender and gender nonconforming people, from the seeking of receiving quality health care. The key findings for this survey would be: the participants report very high levels of postponing medical care when sick or injured due to discrimination or inability to afford it. Respondents face significant hurdles to access health care, including refusal of care, which is about 19% of our sample reported being refused care due to their transgender or gender nonconforming status, with even higher numbers among people of color in the survey. Harassment and violence in the medical setting is 28% in the medical setting, and 2% were victim of violence in a doctor's office. Lack of provider knowledge is at 50%, having to reach their medical providers about transgender care. Despite the barriers, the majority of the participants have accessed some form of a transition. The majority reported wanting to have surgery but have not had any surgeries yet. If medical providers were aware of a patient gender status, the likelihood of that person experiencing discrimination is increased. Respondent reported over 4 times of the national average being treated differently, being transgender, than you would having HIV. Over a quarter of the respondents misused drugs or alcohol specifically to cope with the discrimination they face due to their gender identity or expressions. Every day, transgender and gender nonconforming people bear the brunt of social and economic marginalization due to their gender identity. Advocates who work with the transgenders and gender non-conforming people have known this for decades, and they have worked with the clients to find housing, to obtain health and partnership benefits, or to save job terminations due to being biased. Too often, policymakers, service providers, the media, and society at large have dismissed and discounted the needs of transgender and gender nonconforming people in their communities, and of hard data on the scope and anti-transgender discrimination has hampered the struggle for basic fairness. In 2008, the National Center for Transgender Equality and the National Gay and Lesbian Task Force formed a groundbreaking research partnership to address this problem, launching the first comprehensive national transgender discrimination study. Over 8 months, a team of community-based advocates, transgender leaders, researchers, lawyers, and policy experts came together to create an original survey instrument. Over 7,000 people responded to the 70-question survey, provided data on virtually every significant aspect of transgender discrimination, including housing, employment, health and health care, education, public accommodations, family life, criminal justice, and identity documents. I think this is very helpful with the transgender community because everyone should be created equal. Transitions is a process that some, but not all, transgenders and gender nonconforming people undertake to live as a gender different from the one they were assigned at birth. Not everyone who is born male wants to be a male. They want to be a female. Not anyone who wants to be, or who is born whatever sex they are, they don't want to stay that sex. That's their right. Equal rights for everyone. Respondents were asked questions that helped us identify whether or not they had embarked on a social or medical transition process in achieving embodiment of their gender. We hoped this would be useful to us and to future researchers in considering the role of transition in and, among other things, transgender health, economic security, experience of bias, and family life. Discrimination by medical providers have multiple denial of health care and multiple barriers to care are commonplace in the lives of transgender and gender nonconforming people. Subjects in seeking health care were denied equal treatment in doctors' offices and hospitals by 24%. Emergency rooms 13%, mental health clinics 11%, and by EMTs 5%. And in drug treatment programs 3%. Female to male respondents reported higher rates of unequal treatment than male to female respondents. We also asked whether respondents had been denied service altogether. 19% had been refused treatment by a doctor or provider because of their transgender or gender nonconforming status. Doctors' offices, hospitals, and other sources of care were often unsafe spaces for study participants. Over 1/4 of respondents, which is 28%, reported verbal harassment in a doctor's office, emergency room, or other medical settings, and 2% of the respondents reported being physically attacked in the doctor's office. We asked respondents whether they postponed or did not try to get 2 types of health care, preventative care, like checkups and necessary when sick or injured. We found that most postponed care because they could not afford it, and many postponed because of the discrimination and disrespect from the providers. Participants were less likely than the general population to have health insurance, more likely to be covered by state programs such as Medicare or Medicaid, and less likely to be insured by an employer. 19% lacked any health insurance compared to 15% of the general population. This right here will show you the health insurance by race. Which is kind of neat that I thought it would, we needed to look at that. There are counseling that plays an important role in transition. Medical providers often require a letter from a qualified counselor stating that the patient is ready for transition-related medical care. Transgender people may seek out counseling for that purpose. Counseling may also play a role in assisting with the social aspects of transition, especially in dealing with discrimination and family rejection. Transgenders have to go through a lot, but just know that they're people too, and